But give us a time in terms of us getting back to you. Typically, it's 4 to 5 weeks. And you can only do the verification for the calls that are in 2021. And those will be due. I know we posted this quite a way back, but the hard deadline for that is June 15th. And if you want, you can wait up until that and put all your summaries together and just send them all together. Usually works out a little bit faster for us too, so we can just do them all together. And we're doing this by hand. We don't have like a computer sending it out. We're doing this by hand. So please be patient in terms of getting us back to you. But if it's been like more than 4 or 5 weeks, just DM us on Instagram and we'll get back to you. Another last thing I want to talk about is volunteering. I know because of COVID, things are still kind of like hit or miss in terms of if you want to volunteer or not. But if you're looking to get some hours and you want to volunteer and you want to volunteer from your home, check us out on our official clubmed.volunteering page. And then all the opportunities about what we offer is posted in the bio. And if you have any questions about that, DM the official clubmed.volunteering page about it. But it has everything that you need to know about sign up. And if you have any questions about anything, just DM us and we'll get back to you. Okay, that is it for announcements. Now I'm going to introduce our guest for today. I wasn't even sharing my screen. Oh, okay. Her name is Kristy. She is a OB/GYN sonographer. She's out of Washington, D.C. She has credentials in RDMS, and she's a sonographer in OB/GYN. You might have seen her from her Instagram. Her Instagram is up on the screen. It's at Kristy DMS. Be sure to follow her. She's also a medical sonography influencer on IG and YouTube, so be sure to check her out. And that is it from me, Kristy. Okay. You can share your screen now.
All right. Share my screen. Okay, can you see it?
Yes.
Okay.
If you want to hit view present, there you go. There you go.
Perfect. All right, so my name is Kristy. I am a registered diagnostic medical sonographer, and I have my credentials in abdomen and OB/GYN. Just to share a little bit about myself, like I said, I have my ARDMS, which are my license in abdomen and OB/GYN. I am from Washington, D.C. I graduated from Montgomery College in Silver Spring, Maryland, and I currently work in a OB/GYN outpatient clinic. Just to kind of give like a timeline of how I started from the beginning to where I am now, educational-wise, I graduated high school in 2015. Yeah, I'm very, very young. And I started my prerequisites like immediately. I took the cheaper route and I went to my local community college just to take like my general education classes, all my prerequisites that I needed for my ultrasound program, which probably took like about 1.5 years-ish. And I was able to apply in 2017, and that's where I got accepted at MC in their DMS program. And it was a 2-year program. The program offered me my associate's degree in diagnostic medical sonography and all my certifications and license upon graduating. So I was well prepared to work right after I graduated in 2019. All right. So just to kind of get started of like what sonography is, a lot of people don't really know what sonography is. It's basically ultrasound. Just to clear it up, it's a non-invasive imaging modality that uses like high frequency ultrasound waves to produce imaging for like diagnostic imaging for organs, tissues, blood flow, all of that. And as a sonographer, we use a transducer, and we also use ultrasonic gel in between as a medium to produce those sound waves directly into the body to visualize that anatomy. We create the images, we do videos, and at the end of it, it helps a doctor or physician write up a report to have like a diagnosis. The most important thing in sonography is that we don't diagnose. We are the ones producing the images. So it's very important not to diagnose. You just provide the best images that you can. You describe it as well as you can in your reports, and it's the doctor's job to diagnose it. In sonography, there are different specialties. You could scan completely different parts in ultrasound, and we'll kind of go over them. So the main types of specialties you could go into fall under different types of sonographer credentials you could get. So there is RDMS, which is a registered diagnostic medical sonographer, which is typically called like a general sonographer, which is what I am. And under general sonography, you could get your credentials in abdominal ultrasound, OBGYN, pediatrics, breast, fetal echo, and those are just like the main ones that you could get. And another type is cardiac sonography, or RDCS, which is a registered diagnostic cardiac sonographer, and that typically just deals with just the heart, the human heart. The different types of credentials is adult echo, fetal echo, and pediatric echo. So adult echo is obviously like older adults, is more developed hearts. Fetal echo is dealing with parts within a fetus, which is the baby still inside the belly, and pediatrics.
Can I ask you a quick question about this?
Yeah.
So are all these specialties still like under the same program, like a 2-year community college associate's degree, or is it like more, it has different?
So different programs offer different things. So for example, the program that I went to was branched out with all different tracks, which it allowed me to do general, vascular, and cardiac. We got to choose which one we got into. And you end up learning most of it in the program anyway. I've heard of different friends that have programs that offer all 3 of them, and they get specialized in all 3 of them. By the time they graduate, they could take as many exams as they want. In my specific program, we had to just like pick. So I picked RDMS, and I got to learn abdominal and OBGYN. Some people just pick vascular, some people just pick cardiac, and that was like the focus of their next 2 years. And also there's different programs that aren't even 2 years, like it's longer than 2 years. So that's just how it works, I guess.
Thank you. I just wanted to talk about that.
Yeah, that's a good question. Next one, vascular technologist. That one is strictly just veins, vasculature, blood flow, arteries. And then the last one is musculoskeletal sonography. That one is not really like a well-known one. I just threw that in because not many people are even registered in that. And I'm not quite sure if a lot of programs offer that. But like I said, I went to the general track, which is the first one, registered diagnostic medical sonographer, just RDMS. I got to learn all those different types, but by the end of the program, I decided to do abdominal and OBGYN. All right. Okay. And then this is just like a little diagram just showing the different types of sonography. So like I said, echo deals with hearts, abdominal, ultrasound, examples of abdominal ultrasounds like liver, kidney, spleen, pancreas, all those type of different exams. And for vascular, you can do like lower extremity veins, arteries, and all that. Okay. So I just kind of added in this little chart that I made. If you follow me on Instagram, I'm sure you see me post this chart a bajillion times. But a big question I always get is, how do you become a sonographer? Also, if you've seen any of my YouTube videos, I always emphasize when you are finding an ultrasound program is to find an accredited program. The accreditation is by the CAAHEP. The accreditation basically just allows you to be properly trained, that follows the ARDMS guidelines, and you'll be able to sit for your board exam afterwards. You definitely can go to an ultrasound program that's not accredited. It's a little bit more work. There's a little bit more loopholes to it as far as getting extra training, making sure you're following the right hours, but just going to an accredited program that's properly accredited in the beginning just kind of saves you the headache of it. After you find an accredited program, you just kind of complete the prerequisites, however you may do. I did mine at a community college, which saved me a lot of money. And then you apply. And then, like I said, we pick the different types of tracks. You go into general, echo, vascular. And one thing that I should mention with each of the tracks is that we all are required to take ultrasound physics, which is just a prerequisite board exam that's every single sonographer has to do. So a big question I always get is ultrasound physics hard? It is definitely hard. It's not as scary as like regular physics, like math, but it deals more with the ultrasound waves and how it works and how the sound beam bounces off tissue. So with taking the board exams, you have to take your physics board exam, and you have to do your specialty board exam as well. So like I said, I did my abdomen and my OBGYN. I might do my fetal echo sometime in the future, but right now I think I just need like a little break from it. So, and let's see.
Okay.
Oh, go ahead.
Oh, continue. Actually, continue. I think you'll touch on it.
Okay. So, I always have these. I'm just covering like all the questions that I always get with sonography. So people are like, okay, you always say you have to pick a good ultrasound program. Well, how do you pick a good one, and what should you be looking for? These are the questions that you should always consider when searching for a program. Like I always emphasize, make sure that it is accredited. And I have it right there, the CAAHEP. Just is the board exam to complete your credentials to be a sonographer. Also, you should always ask like what type of degree is offered after the program. In ultrasound, you don't need a big fancy bachelor's degree. You don't need an associate's degree. Really, you don't need any degree. You just need to go to a properly accredited program that offers it. My program did offer a degree. I would highly recommend it just because you get like the full effect of like the learning experience. But that's fine, doesn't really matter. And then what are the credentials you get afterwards? So you just want to make sure that you can get your ARDMS after, and so you're not wasting your time. And always consider the cost and the length of it, because you don't need to have a big fancy degree and spend a bunch of money to become a sonographer. That's just something I always emphasize. It's definitely possible, but I always want to take the smarter route around it.
Yeah.
And then, of course, the prerequisites, you have to think about all the prerequisites they take, such as like anatomy and physiology, physics, general education classes, all of that. Yeah.
So after high school, did you? I'm sorry if I missed it. Did you say how many years you spent for completing the prerequisites, or can that vary?
So what I did after high school, I looked up every single program in my area, and I kind of just aligned all of their prerequisites together, and I saw which ones correlated, which ones were the same, and I just took those all per semester, whatever, and it took me maybe about 1.5 years to do, but that was just because I kind of accelerated it, as in like I did my general education classes first, like English, math, science, all that stuff. I did like winter, summer classes. So realistically, it probably could take like 2 years, 2.5 years maybe. But I wanted to like apply to my program properly in the right time frame. And yeah, so most prerequisite programs or prerequisites for ultrasound programs are going to be like anatomy and physiology, physics, communication, psychology. Every program is completely different. So that's why whenever people ask me like what classes I took, I kind of just give like a broad answer to it. But those are the main ones. And of course, I'm sure everyone who's taken anatomy and physiology, they know how hard it is. Like that class probably kicked my butt, but I feel like that kind of gives you a taste of what like the medical field is like and how hard and vigorous any medical program is, whether it's sonography or, any other type of program. So yeah, it took maybe 1.5 years. Then my program itself was 2 years. There are a few programs by me that are less than 2 years. Like I know a few that are like 13 months. I couldn't imagine doing an ultrasound program in that short amount of time, but I guess it gets the job done.
Quick. So it kind of all depends down to like what kind of pace you like in terms of how you want to get your classes done. You can do it quick if you want to, or
exactly
you can kind of take it slow and and that's
yeah,
all up to you.
Yeah, I always emphasize like, people always ask like, how long did it take you? Like, will it take me this long? It's kind of like whatever type of drive you have, and how much stress you could overload with your classes, I guess. I made sure to like never take hard classes together. Like I wouldn't take like anatomy, physiology mixed with physics. Like that'd just be too much. I would just like go crazy. So it's really up to like yourself and your personality, like what you could handle as far as like the stress level. But I mean, it's possible.
Yeah.
Yeah, and every program's different. So it could be hard, it could be easy, it could be fast-paced, slow-paced. That's why you kind of like got to learn your own teaching and learning style while you're going through these things,
Yeah.
which I
And
definitely
that
have.
applies to not just this in terms of any program that you want to go into. And
Exactly. Exactly. Same exact thing. Yeah, I would think so. I would think that would apply to like any type of program, any type of schooling, actually. Um, okay, let's see.
there's a question from Sydney. I know you're going to get into this, but I'm just like, what's the biggest difference between sonography school versus the actual career?
The difference between sonography school and actual career.
So like in terms of what you do and actually
Oh,
how it ended up being.
okay, so in school, obviously you learn like the educational part of it
Yeah.
for your board exam. That part, lots of hard work, lots of studying, but that was just to prepare you for the actual board exam itself, which is like a computer written test. Sure, you could read that all and you could comprehend the information, you could know what ultrasound looks like on paper, but at the end of the day, you know, you're scanning on real patients, you're doing real physical work. Ultrasound is a user dependent field, as in like I had to physically hold a transducer in my hand to get the images, rather than like with CT, you reposition the patient, you take your images. It's all like by the sonographer. So when you're in school, you know, that's your time when you're doing clinicals. You have like another sonographer that you're shadowing that will hold your hand and kind of like teach you what to do. So when I would scan on like real patients while I was a student, yeah, it was like really nerve wracking, but I always knew that there was like, oh, if I didn't get a picture, like, you know, the sonographer I was shadowing would get the picture, or like she'll come in and kind of show me how to do it. Um, and there's like different things that come into the aspect, whether like the patient has like a high BMI, the images aren't as clear, or like if the patient's really gassy, stuff like that. So going through school was like the time to make the most mistakes that I had. But then like once you're in the real world, there's not someone holding your hand behind you. You know, you have to have a lot of like critical thinking skills. You have to really bring in those like scanning skills that you learn from your techs and your teachers. Um, because like you're the one taking the pictures. There's you could say anything, but at the end of the day, I would say like you have to find a lot more confidence when you're out in the scanning world by yourself rather than with school. There's a lot of dependability with school. Um, yeah, I think that's with anything too.
Yeah. All right, makes sense. I think we're good for questions for now if you want to continue.
Okay. Oh, yeah, I keep on clicking it. Okay. So with sonography, people always ask like, what's like your schedule like? What type of work environment can you work in? There's so many different things you could get into. You could be an outpatient clinic, a hospital, and you can even do traveling sonography. Outpatient clinics would be like an OB/GYN office, which is where I work at. With regular general sonography, you can work at a radiology imaging center, like outpatient clinic that you just go and get your imaging done, send it to your primary care. If you're a vascular tech, you could be in like a vascular office, like a vascular specialty lab. You could even work at private practices, doctor's offices, and stuff like that. When I graduated school, I actually worked for a private practice and I really liked it because it was like small, intimate, you know, you work directly with the doctor. So it's kind of like whatever your style is. Obviously, you can work in a hospital. I feel like hospitals are a little bit more fast paced. You know, there's always ER situations, add ons, emergency situations. You scan inpatients and you scan outpatients and ER. So it's a little bit more fast paced. It wasn't my cup of tea because it was just a lot to like handle. But some people like love it. They're like driven by it. I have lots of friends that I graduated with. They love the hospital setting. And yeah, it's kind of just like up to you. So if you want to do like regular general, you can be in the radiology department, ER, vascular labs, of course. If you're echo, you do cardiacs. A lot of children's hospitals, that's pretty big. That goes hand in hand with like pediatric sonography. And yeah, traveling, I decided to add this in because when people think of like traveling, anything medical, they think of like traveling nurses. So it's the same thing with sonography. There's traveling temp agencies. I considered doing that for a little bit right before like COVID hit, and I was like, maybe this isn't a good idea. But I thought that was pretty interesting. It's basically the same thing. You work for like a temp agency. They send you for like short duration assignments. They're generally usually like 13 weeks assignments. But they'll send you to like an outpatient office. They can send you to a hospital. And I would say if you consider like that type of route, you have to be like pretty good at like adapting to new things, because with sonography, everyone has different protocols as far as how they scan, how the doctors want the images, what type of machines. There's completely different ultrasound machines. There's like millions of different ultrasound machines, and all the buttons are going to be in different spots, and you're adjusting your images in different spots. So I would say you have to be like in a pretty like good adjustable state and experience to do that. But it's good to explore and know that that's an option too, because I know a lot of people go into nursing because they like the traveling nursing aspect of it. So that's always good to consider.
Kristy, I just have a quick question. I think apply this again from Sydney.
Yeah.
Between all the different work environments, do sonographers or you ever have to work on call or?
Yeah, for sure. So hospitals obviously are probably the more likely to be on call, especially if you do like night shifts, weekend shifts, especially in like a radiology department, maybe even ER, because ER is always running. But actually what's unique about like on call, it could be with anything. So I currently work in an outpatient clinic right now, and I work at an OB/GYN office, and I actually do have on calls too. So that's just because like how I made my schedule, I allowed myself to work 4 days a week. But also I give them the leeway of like, okay, like, you know, Chrissy's will give you like an extra day like this month, and I'll be on call. But it's usually within reason. It's not like, you know, you'll get a call like really, really randomly. I think that's more like a hospital setting, especially if you're on call like at night. And you know, you have like a bunch of like ER stat ultrasounds, then yeah, that'll probably be more that. But like I said, it's whatever work environment you decide to go into. But on call is possible, no matter which one.
So typically, like for you, typically you have like a schedule set, and like that's what I'm gonna do. And in case there's like something that comes up, you know, not every now and then, rarely if something comes up, you'll add on a day, you know, to help
Yeah,
them out.
exactly.
Pretty much that's it.
Yeah, so that's just my personal choice, because the reason why I like outpatient is just because, you know, there's a set schedule. Like I know what I'm expecting. I do get emergency situations as far as like, oh, Kristy, we need to add on this patient, you know, she's having bleeding, something like that. Okay, I'll add her onto the schedule. But it just adds a little bit more order. It's like less chaotic. So I personally like it that way. And I guess being the on-call to like an outpatient clinic, it also gives me a little sense of like the craziness when I need it. But I rarely get on call. I get called in sometimes. But also it's like, you know, sometimes when you're just like chilling at home, like you're like, oh, I wonder what's happening at work.
There's another question
Yeah.
from Corin. Do hospital shift works 12s or 12-hour shifts, or how many hours do you work as outpatient typically in a day? Like, do you work
Okay.
an 8 hour?
So with hospital, like I said, with every different work environment, there's different hours that are offered. So for hospitals, you can work 8-hour shifts if it's like a regular radiology department that opens at that time. If you work more of like the ER setting, you could do like 12-hour shifts. And there's even like 10-hour shifts. So it honestly kind of depends on like what you decide to ask and like contract with wherever you work at. Actually, what's unique about the private practice that I worked at when I graduated, they were an outpatient office, private practice, but it was open for 10 hours. So I had the luxury of working at an outpatient clinic, working 10 hours and only working 4 days a week. So instead of me working like, you know, regular 8-hour shift, 5 days a week, I was like, you know what, I'm going to work an extra 2 hours a day, so then I can only have 4 days off. So once I was exposed to that 4-day schedule, I was like, wow, I love this. Or like people who work 12-hour shifts, they love just working 3 days, right? Yeah. So now when I apply for new jobs, the first thing I ask them is like, do you offer 10-hour shifts? Do you offer 12-hour shifts? But that's just because I like just like working long days and just be like, okay, I could have a 4-day weekend if I wanted to. So obviously that's something you would have to like ask. But hospital settings, probably more of the longer hours. But I can say from my experience, some outpatient clinics will offer you 10-hour shifts or 12-hour shifts, depending on where the clinic is, if it runs 24 hours or if it runs a certain amount. Because most outpatient clinics only run like you know, like 8 to 5 or something.
Yeah. And it all comes down to, at the end of the day, like, what do you prefer and what you want, and depending upon that, you can work with your hospital outpatient clinic to get that, I feel like. But yeah.
Yeah, it's such like a good, like, it's a diverse like choice, and especially like, you know, you'll go through school and you'll see what you like and what you don't like. See, like me, I was just like, I love the 10-hour days. Like, I don't know, it just made it so like, oh, I just have my day off on like Friday. It's so nice. So that's like, especially during COVID when I was going to, like, on the job hunt for a new job, that was the first thing I asked. If they didn't offer it, I'd be like, all right, I don't like working 5 days a week. I'm not accepting it, and that's okay.
Yeah.
And they'll be fine. They'll be fine.
Yeah. Well, yeah. We can continue on.
Okay.
We'll do questions at the end.
Yeah. The questions are cool. Yeah, different work environments. Okay. So my sonography specialty, and that's also me, I'm scanning my friend right there. She was like maybe like 30 something weeks pregnant. It was really cool. So I do OB/GYN sonography, and that's usually like the first thing people think of when they think of ultrasound. So OB/GYN, you know, obstetrics and gynecology sonography, commonly referred to as OB/GYN, is just a type of imaging modality for OB and GYN. So OB obstetrics, which is dealing with pregnant women and their fetus. So with this type of sonography, you don't just have one patient, you have two patients, or 1.5 patients, I guess. And so with this, you know, it's a little bit more like critical thinking. You have to think of the maternal health and also the baby's health and how they play a role with each other. Another thing people sometimes forget when they think of like OB/GYN ultrasound, they forget that there's like the GYN aspect of it, as in gynecology, the woman reproductive system. So people go into ultrasound, they're like, I just want to scan babies all day. No, you can't just scan babies. You have to deal with, like, you know, the women reproductive system, where the baby comes out of. And then they get totally turned off by it. But it's like, it had to get there somewhere. Like, like, you know, like, it's, you have to deal with both, like, not just baby, you got to deal with the mom too. Even postpartum, like, you have to deal with the gynecology aspect of that. So it's always something to consider. So a day in life as an OB/GYN sonographer. Like I said, I currently work in an outpatient OB/GYN office. I scan pregnancies and women reproductive care. My patient types are women, obviously. I don't really have any guy patients coming in, besides if it's their partner. And typically, patient-wise, in an outpatient clinic, in total, it could be like 35 to 50 patients a day. I know that's such like a big range of numbers, but it's always depending on like how many sonographers you have with you. So typically there could be like 2 to 3 sonographers. We have 3 rooms where I work at, and that's typically how many people are going to be in a sonography setting. If it's outpatient, like, you have 2 to 3 other colleagues with you, and you'll kind of split it up. So that's why my range, like, I could say I have 10 to 20 patients, because if it's a slow day, you know, we all get like 10 patients each, 10, 12, 15, whatever. But then also you consider, like, when there's emergency situations, like, oh, Jane Doe had bleeding, you know, her baby's not moving, you know, we'll have them come in. So we'll have like a lot of add-ons with that scheduled patient. So the patient load, definitely I would say outpatient could be like really, really high capacity of patients. And hospitals could also be like that, but also sometimes hospitals could be totally like empty for hours, and then you get hit with a bunch. So like, I've been in a hospital where I only did like 5 patients a day, and I was like, okay, this is kind of boring. Which I think is why I like the scheduled thing. Like, I know what I'm expecting. But yeah, hours wise, like I said, it varies from what work environment you're in. A typical outpatient setting is like 8.5 hours, you know, 7:30 to 4 or 8 to 5, whatever it is. But me specifically, like I said, I prefer the 4 days a week thing, and my job is pretty luxurious. I only work like 32 to 36 hours, still full time. And like I said, my previous job, I worked 10 hours a day, and I was hitting like a good 36, 40 hours a week. But I just like the comfort of having a day off when I needed to. The hours were long, but it just makes it like worth it, because I don't know, I just don't like working 5 days a week. It's just too much. Yeah. Some examples of exams that I perform. So some OB examples are complete anatomy survey exams, which is basically making sure that you're doing a complete survey of the whole baby. So this could be maybe like 50 to like 100 pictures. You are scanning from head to toe. You're making sure everything in the brain is present, everything in the heart is good, no holes in the heart, all the organs, stomach, kidney, bladder, making sure those limbs are present, fingers, 5 toes, all of that. This exam takes the longest and you take so many pictures, but this is like the most important. It's usually done at 20 weeks. And that's like, you're making sure everything is good. Viability and dating confirmations. This is usually the time where, you know, you first find out you're pregnant, you want to confirm if there's a baby in there and there's a heartbeat. Growth exams are like routine exams that happen, you know, every 4 weeks, every month, or every few months to make sure that the baby's growing efficiently. And this is also the time to see like if there is any like growth restrictions as far as like any type of abnormalities causing the baby not to grow or grow too much or too fast. Biophysical profiles, those are just kind of like wellness checks on baby. It's just like a limited like, okay, let's check your fluid, all that stuff. And first trimester screenings are a type of screening for any congenital chromosomal defects in the first trimester. And then GYN ultrasounds are reasons for like bleeding, fibroids, cysts. Where I work, we do ultrasound guided sonohistograms and IUD guidance insertions. So all of those procedures are different things that go hand in hand with ultrasound. And they're just procedural things that use ultrasound guidance to make sure they're not going in the wrong spot. Okay, I made a little video of, it's just like a quick, like what it is from like start to finish of what I do. We gotta put it in HD, okay? Hopefully you guys can hear it. Hey guys, it's Kristy. Come with me on a day at work as a sonographer. So the first thing I do is I grab the patient and I make sure to review their patient chart, see if they have any weird patient history, and to check out the reason of why they're getting their ultrasound done. I'll grab the patient back and we'll head straight to the exam room. And I'll ask them a few questions, any symptoms, and then I get started with the ultrasound. I make sure just to cover them up very comfortably so I don't get gel all over their clothes. Most importantly, next, you gotta add a lot of ultrasonic gel just to make sure you're using a good amount for your scanning. Next, I'll just perform the ultrasound as it was ordered by the doctor. I'll do my measurements on the baby, make sure there's lots of activity, measure the heartbeat, and then I'll write up my report of all the sonographic findings I find. Lastly, you clean up and you repeat the same exact thing with the next patient. So this video I did like a really long time ago. I'm sure if you guys have me on YouTube, you know where this video is from. And that's actually my friend that I scanned, which is cool because her baby's like about to turn 1. Yeah, that's just like a typical day of like what happens. You just grab the patient, make sure they have any like patient history, if they had like surgery, what's going on with their baby, stuff like that. And then you start the exam and you finish it. You write up the report, send it off to the doctor, and you repeat it again all day, 10 to 20 times a day, 10 to 20 times a day. These are just other things that a sonographer does besides scanning. I briefly went over it a little bit, but it's more than just like scanning and taking pictures. So like I said, you review the patient's history. We are responsible for stocking our exam rooms as far as making sure there's always gel, because gel is the main thing that we need to do our ultrasounds for a medium in between the probe and the patient. We do write our preliminary reports, and like I mentioned in the beginning, that we do not ever diagnose. That's not our job. Our job is just to report our sonographic findings and show like exactly what we're looking at. We can't give details if it's benign or malignant. That's the radiologist or doctor's job. And you know, we're just kind of like, we're the patient's eyes, or we're the doctor's eyes, and we're helping them diagnose. And also things, we do assist in surgical procedural things, as far as like amniocentesis, paracentesis, biopsies. and stuff like that. So a lot of people always ask me like, oh, does your job involve like a lot of blood or anything like bodily fluids? This is probably like the most you'll get into bodily fluids. Maybe you're not physically doing it. You're just kind of like helping the doctor do it. Like I said, you're just being the doctor's eyes and helping assist in that. Okay. This one I wanted to add because people always ask like scanning babies, like it's such a fun job, right? Like you must love scanning babies all day, every day. So I wanted to touch base on this because that's false. Although I do love my job, it's a lot more than just scanning babies and just looking at it and be like, oh, that's so cute. Your job is to find abnormalities. So, you know, you'll see a lot of normal stuff and it'll be like very nice and you'll see all those cute babies. But there are a good amount of the day where you see a lot of fetal abnormalities, you see a lot of miscarriages, you see, you know, fatal diagnoses that you don't ever want to see, like congenital heart defects, chromosome abnormalities, missing limbs, non-viable pregnancies, brain defects, all of those things is part of our job. You know, nobody ever wants to like see that type of stuff, but if we aren't the ones seeing it, you know, the expected mom doesn't want to see it after birth. So that kind of gives them the choice of how they want to continue the pregnancy and how they want to deal with the prenatal care of it. So yes, we do scan babies all day, but it's not as fun as everybody thinks. I personally, I do enjoy it. It shows me like all of the new different things. I'm always constantly learning when I see a new abnormality. And it just kind of makes me want to be a better sonographer just because I see something and I'm like, wow, like I'm so glad I caught that because, you know, later on in life, you know, they could be able to fix it and be able to like properly care for that patient in the way they need to for the rest of the 9 to 10 months.
That was good. Do you have chance for me to ask you a couple questions?
Sure.
Okay. This is going to go back a little bit.
Okay.
So this is going back to when you were applying for your sonography program. A couple people asked about this, so that's why I'm asking.
Okay.
Did you have any volunteer experience, or for somebody who's looking to get in the door? Did you work in the field or an outpatient clinic before getting into the program?
So I personally, the only medical experience I had before was I worked like front desk at like a hospital at a rehab center, but that was just because I wanted to have like that medical experience like on paper on a resume. I do know a lot of programs do require shadowing or shadowing just like this, shadowing or volunteer work. Honestly, it kind of just depends on the program you apply to, if that is a prerequisite for it. Sometimes it's literally just like a checkbox that they just want you to have. And of course, I always recommend like, yeah, you should volunteer and shadow just to see if you really like it. Like I said, a lot of people just think it's like a fun job, you know, you're scanning babies all day, but you know, actually being there and seeing a person physically scan like up to 10 to 20 patients a day, like you see the workload of it, you see how much of a toll it puts on like a person's like body from scanning. But yeah, volunteering, I did not have to, but I do hear from a lot of people that they are required to.
Gotcha. This is kind of going into the work that you do. Kaylee wants to know, are you allowed to tell the patient when you see defects or any problems, or is that the job of the doctor to tell the patient?
Ooh, that's a good question. The answer is no, you're not allowed to tell them. And it sucks. Like you see this and it's like, you know, it's bad and you can't say anything. Yeah, it's the doctor's job to deliver that news because they're the ones diagnosing it. Generally, if I do see something, me as a person, I would feel bad if, you know, like someone had just did like a full 45-minute exam on me and said nothing. I would never say like, oh, there's something scary or, oh, you know, there's something bad. You know, I kind of give them a little heads up to be like, oh, I'm kind of having trouble seeing this. But the doctors are going to look over my pictures and kind of confirm it for me. Most of the time they'll be like, is it bad? Is it bad? But I'll be like, you know, like, I'm not sure. And then I kind of just say like, well, I'm not a doctor. And then they're just like, you're right. You're not a doctor. And then they kind of feel better. As far as like, if it's like a miscarriage or something, I personally, I will give them that heads up a little bit because that is just not a good feeling, knowing that like, you're with them for like a few minutes and you said nothing about it. That's just me personally. A lot of sonographers, they're just like dead silent. They're just like, nope, stale. I'm not saying anything. But that's our job. We're not allowed to say anything. So the answer is no, you're not allowed to deliver the bad news. But me personally, I always at least try to give like a heads up, because that's not a good feeling. I just know that.
Yeah, that makes sense. Kind
Yeah.
of like prepare them into.
Yeah, like
I
I
can't tell you
prepare
what
them
it is
enough
exactly,
so
but
they,
I'm
yeah,
going to put you, and the doctor will tell you more. That's kind of how it works too. Yeah.
exactly. It's like you don't want to just leave them hanging, because then like later on you walk in the waiting room and they're just like, there's that girl that didn't tell me what was wrong with me. Just giving them heads up and being like, just making them feel at ease, and then just be like, well, the doctor will explain it more, and then they'll feel okay.
Yeah, and there's another question
Yeah.
about like this kind of anxiety, like Madison. Like, what advice do you have in order to keep like the patient comfortable and not freaking out if you see something?
That's a good question, because I have developed that skill and I'm actually really good at it. I would say, especially during the whole ultrasound, I communicate everything I'm looking at. So there's never like a pause of like awkward silence where the patient's like, is everything okay? Is everything okay? So like if I'm scanning like their baby, I'll be like, okay, now I'm gonna look at the head, I'm gonna measure this. Everything looks present here, everything looks like that. So they're always constantly informed throughout the whole exam. There's not really a time where they have time for them to ask questions. And as far as like if you see something for sure is wrong, like I said, I give them like a little heads up, that I'm having trouble seeing something, or this kind of wasn't clear for me. But what I'm going to do is I'm going to go over it with the doctor, and then the doctor will be able to tell you exactly what it is and how we could take care of that. So it makes the patient feel at ease, it makes me feel at ease, and hopefully the doctor too. It it definitely can get like emotionally nerve-wracking if you see like a bunch of sad things throughout the day, but not saying you develop like, not saying you get like stale to it, but you develop like a professionalism to it. You develop more like empathy to the patient. You know how to handle it. I kind of just imagine if it was like me getting that news, and I'm just like, like how would I want my health professional to like
Yeah.
coddle me? I don't know. I don't know.
So would you say coming into clinic, good news is always having no news?
Oh yeah, exactly. Right. Like,
Yeah. Good news is always having no news. Okay. Um, how much time do you typically have, like per patient, to scan them and move on, or that just depends per patient?
so how my schedule works, we have patients every half hour, no matter what type of exam it is. So like I was saying, with the anatomy exam, that could take up to like 45 minutes. Of course, with experience, you get it down to like half an hour. But if you see like an abnormality, that adds like extra 5-10 minutes. So typically I have patients every 30 minutes, but that's just because, each exam could be like 45 minutes. My next one could be like a 10-minute exam. The next one could be like a 20-minute exam. So it smooths its way out. Um, I have heard of luxury places where they have hour-long exams, and I think that's so nice. Um, and I also have another friend, who has 15-minute intervals of exams, and she's by herself. I'm sure if you guys follow other sonography influencers, you probably know exactly who I'm talking about. But like I couldn't imagine having to be forced to do an exam that's so like intricate and diagnostic in 15 minutes. Like, especially if it's like, me doing it, like that's just too much. But typically for most of the places I've worked at, it's been 30 minutes between. And there's always other colleagues that'll like pick up the slack when that happens.
Okay. This is a bit of a from Ash personal question, but you can just give an average advice in terms of salary, in terms of what specialty or what do you expect on average going into this job you can expect to make within the year.
Okay. So salary is always such a weird question because it's so different in every state.
Yeah.
When I was getting into the field, I do know cardiac is usually the most highest paying job because it's dealing with the heart. Most people go into general, which is what I do. But to put a number on it, I don't know, like I would say it's a pretty good salary coming out, at least like 30 something an hour or something, if that kind of gives it a better
Oh,
idea.
that's good. That's definitely
Yeah,
triple. No, that's good pay. In
that
my
is good pay.
yeah,
I have heard of people getting lowballing, getting like 24 or something an hour, which, you know, I people are probably listening like, oh, like that's how much I get paid. Like I said, it's in different areas. So I'm from like the DC, Maryland, Virginia area, and living in DC is like so expensive, right? So um yeah, pay could be like 30 something usually. And I've heard of places where they pay 40 to 50 an hour. And I was like, wow, I want to go there. I don't know where that is, but I have heard of that.
yeah.
So I would say
It
not
just
lower
varies.
than, I don't know where it is. I gotta find it. It's definitely not lower than 20. And like if you were working somewhere less than 20, you gotta move somewhere. That's not where it's at.
Yeah, yeah, that's good. But yeah, depending on where you are, that can vary depending
Exactly.
on what you're doing, your specialty. There's a lot that goes into it,
Yeah,
but at the end of the day, you're probably not going to go into for just for the salary. It's about what you if you like it or not.
exactly. That's right. You don't go into the salary, but that is a good question. I was so
Yeah.
like, yeah, 26 an hour, 30, high 30s, mid 30s. Let's go with that. That's the range I'm going to stick with.
Okay. There you go, guys. Um,
Yeah, I hate answering that question. I always feel bad because they're going to be like, well, I didn't get paid that much. And there's like this whole thing.
it varies. But I'll move on from this. I have another question from Madison. What's
Yeah.
your biggest piece of advice for days where you feel very overwhelmed with the new information and skills to learn as a sonography student? And she thanks you for doing this.
Oh, yay, you're welcome. I love doing this. Advice as a sonography student, especially when you're burnt out, just don't get discouraged. Like anything in the medical field, you just kind of have to push hard and learn what works for you. Don't lose like the confidence and drive of it, because like anything in life, not even just the medical field, it's going to be hard, and you just have to work hard towards it. And especially something that is hard, it's so easily to get discouraged by. And just kind of remember like what's the reason that you went into the field? Why do you want to pursue this? What drives you to do it? And just use that as a motivation every single day to do it. Like my drive was like to do it for my mom, and it was just like it's just like little things that just like push you to be harder to work towards it, and build a lot of confidence, especially like in sonography. Nobody's going to hold your hand. You're on your own, so learn as you go and just work hard. I don't know if that's just like a typical fortune cookie advice, but that's what I got.
There you go. I think we're all good on questions. Do you have anything to add before we close out, Kristy?
I guess not. I still have more slides, but it's all right.
Do you have more slides?
I think so. I think so.
Okay. Do you want to finish them out?
We'll just go through them.
Yeah.
I don't know how many of them. Oh, I have the case study. Do we want to go through a case study, or it's just too much?
Um,
It might be too much. It might be too much.
yeah, we're probably running a little bit low on time. So, but I think it was an awesome call. I learned a lot about this field.
Yeah,
And thank you for your time, first of all.
sure. Oh, I also have this one last video. It's 2 minutes. This is maybe less than 2 minutes. Can I
Go
play
ahead.
it
Go
instead?
ahead.
Yeah, let's do that instead of my case study. Okay, well, this is my case study. We're just gonna go through it real quick. Sonographic findings um, about the placental stuff. So if you guys follow me on Instagram and YouTube, you guys know that I won the ARDMS YouTube video. ARDMS is what is in control of all of ultrasound's license, guidelines, all that stuff. And this was the video on just talking about the importance of sonography in the medical field and how we play a role in it. So I think this is just a good video to just kind of sum up everything of what I taught you guys today, and just to kind of see like how the field is. All right, let's do this. You guys just watched it on my YouTube, but I'm going to play it anyway. In HD, of course. Hi, my name is Kristy. I'm a registered diagnostic medical sonographer. I am registered in abdomen and OBGYN, and I currently work in an OBGYN outpatient office.
I'm Dr. Julian Safran. I'm an OBGYN practicing just gynecology now, and I've been in practice for over 40 years. So currently, in the past I did deliveries, surgery. Now I'm doing just office gynecology. So that's the extent of what I do.
As a sonographer, I use ultrasonic waves to image anatomy of the human body. Sonography, you're basically the doctor's eye. So our goal is to take anatomy pictures, make sure there's any pathologies on it, make sure there's no abnormalities, and those images go to a radiologist or a doctor for diagnosis.
Sonogram is so important. It's critical to patient care. Been doing this for 40 years. So when I started, you could barely see anything on a sonogram machine. And it was just the gray squiggles, but you got a sense of there might be a mass. Now, the technology is so good, you can't live without it. You want to know if a patient has a serious problem. Is there a mass? Sometimes it's difficult to palpate based on the patient's body habitus. Sometimes it's difficult based on just their tense, or it can just be hard. And what sonogram gives us, it almost gives us a way to see inside, so that we can see things that we can't feel. And what I would do then is for patients who needed a sonogram where it was urgent, we'd be sending them out of the office. They would be going to another facility where there was a sonographer. I think there's nothing that's done in life where you don't need a team. Even if you think, oh, tennis, you don't need a team, but you do. You need a coach, and you need people to work together to make things flow and work. They are absolutely 100% critical to providing patient care, gynecology or obstetrics.
As a sonographer, I love the intimate patient care. I love being able to provide good patient care to help with their medical journey. Also with sonography, it's always a challenge every day. Every single case is completely different. Everybody's bodies are different. And it just gives me a challenge throughout the day with all the different types of exams. So I'm always constantly learning.
That was good.
Thank you. I worked really hard on it. That's actually my current job right now, that place where I was at. And that's my boss that was in it. I was like, you want to do a video? He was like, yeah.
Yeah, he was practicing for over 40 years. That was really cool.
Yeah, he's a good guy. And then be sure to follow Kristy DMS.
Yes. Thank you so much. Sydney says this was a very well-made and informative presentation and video, and I agree with that. It was very, very well made. So thank you for that. Thank you for your time. Before we close out, I want to say a couple of things. I'm sorry if I didn't get to your questions. I tried my best to ask everything that I could, but I know with the time limitations, we can only get to so much. But I know Kristy posted a lot of YouTube videos. So if you want to get to know more, I'm sure she has more in-depth stuff on what she does in her videos. So be sure to check her out on her Instagram, YouTube, Facebook. Hit her up, guys. She's good. I know she has great content for you guys. So be sure to check her out. And we will have a call again next week. So you can stay up to that with our following, keeping up with our Instagram, and we'll put more details about that throughout the weekend. So thank you so much, guys.